Welcome back, friends. The team at T-Share, which is short for Take Charge, wants to help support those in our community who are most vulnerable to HIV. Here with some information on how easy prevention can be are Jasmine Davis, co-investigator at T-Share, and peer navigator, Sailor Payne. What's happening?
Hi.
Thank y'all so much for being here.
Thank you for having us.
Of course, y'all look fabulous, and I love what you all are doing. I was learning all about T-Share. It's so great what you all are doing for the community. And first, Sailor, I want to ask you, T-Share, it's actually historical to how the program started. What does it mean, and what can you tell us?
So T-Share stands for Trans Community Health Education and Research, and it actually comes from the Cajun word share, which means darling or dear.
Darling.
So that, comes with our participants who are wanting to feel more safe in a healthcare environment. So, we want them to feel nice and comfortable.
It's so true.
So yeah, it all just ties back.
I love that.
Yeah.
Yeah, come on, share. And look,
Wow.
it's so important because look, we know this. Trans lives do matter,
Yes.
okay? And what's interesting is that you all have been doing a lot of different studies. And Jasmine, you found that trans women are at more risk of HIV. Why is that?
Because of the lack of education, lack of access to resources, lack of supportive services as well. Social determinants of health is something that is rampant in all marginalized communities,
Absolutely.
honestly, and trans women, trans folk, period, are definitely being affected by it.
It's so true, and yes, let's let people know anybody is eligible of getting HIV. So it's important that we all have the education on what this disease is and how to prevent it. And one way to prevent HIV is getting on PrEP. You may have seen the commercials, especially if you're a big fan of RuPaul's Drag Race like me. For people who are unsure about what PrEP is, what can you tell us? How does it work, and who's eligible? All the questions.
Okay, everyone is eligible.
Yes.
If you are sexually active, or a person that is, or a person that is susceptible of contracting HIV, PrEP is for you, or may not be for you. The PrEP is a pill that one takes to prevent themselves from contracting HIV,
Right.
and it's not only in a pill form; it is in an injection form as well. There's
Different options.
yeah, there's different options with it. Pill form, and there's also the
Is it like an injectable?
Yes. There's also
Yes,
a new
there's
PrEP.
an
There's a new PrEP injectable actually coming out soon. That's you only have to take it twice a year. So
Really?
it's not approved yet, but it might be coming out soon, which is
Come
really
on.
exciting. So
Yes,
people don't have to worry about taking a pill every day. So yeah, that's
It's
really
so
exciting.
important. And
yeah.
I think what you do, Sailor, is such a powerful position. You're a peer navigator, right? Tell us a little bit more about the work that you do with T-Share,
Totally.
because it's so great to have a resource.
Yeah, well, the nice thing about T-Share is most of the people that work there, we are trans experience.
Yes.
So, when you are talking with us, you're mainly talking to people who know, the struggles and know about you, and it's like really cool. We also have a full-time social worker on our team, Conchita, who can help you too. So we have a really cool team, and it's really nice to get back to the community and help them out and spread awareness for PrEP, because like we said, everyone can take PrEP. It doesn't matter if you're gay, it doesn't matter if you're trans or anything like that. Everyone can take PrEP as long, so.
Because
and
this
when
is a disease that affects everyone.
Yes.
Remember, this
Yes.
is a disease that you can get it too, so it's so
Yes.
important to be educated about it. And I love that you all are of the trans experience, so much so that at T-Share, you all are doing this intervention study that you are looking for people who are of that experience to take part in. Tell us about what it's all about.
Okay, well, our intervention is a 15 to 27-month study. It offers peer navigation, access to peer navigators, and also an access to a licensed social worker. We use a text messaging system in order to engage with our participants, sending different affirming text messages or helping navigate certain systems like healthcare or even insurance or food insecurity, helping apply for food stamps, helping with education, job readiness. It's just support. It's supportive services. Our licensed social worker is very, very vital to our team because she's there for crisis when it comes to suicidality or any other kind of life experience that you have to deal with. There's a lot of people that really don't understand that social determinants of health is like life things that stop you from getting the proper health care or even concentrating on the proper health care. And so we're just there to, offer that support.
And I love that you all are doing that. What are the requirements? You have to be, 18, 21? You have to be of the trans experience? What do we need to know when it comes to applying for this?
With applying for a study, we do have a screener. So when you do call us, we'll do a little screener with you and see if you're fully eligible. And like you said, you have to be at least 18 plus, and you have to identify as trans woman, trans femme, non-binary, or non-binary femme, as long as you're femme and of the experience.
And male listed at birth.
Yes.
Male listed at birth, so
male
like on your
assigned at birth.
ID and all of that?
Your sex assigned at birth.
This is so great that you all are doing this, because I say this all the time on the show. There is more that brings us together than sets us apart. And it's so important that people of the trans experience have the opportunity to live the life that they want to live. For someone who may be watching this right now, who may just not know where they are, what they feel, what is some advice you can offer them as a peer navigator, Sailor?
I mean, a nice thing is just like, do what feels right and feels comfortable, I was lucky enough to grow up in a household that let me express myself and feel free.
Which is so great.
Yes. My mom's actually here today with me.
Yes, that's your mother?
That is my mother, yes.
Hey, Mom, thank you, Mom, thank you.
I'm very lucky, but just do what feels right. And if you want to try something out, try it out. If you don't like it, you don't like it. If you like it, you like it,
Right.
And I will say one thing about our study too, which is really nice, is that you can earn up to $1,055 with being part of our study.
Oh, there's money
So you
involved?
earn money and you get to learn about safe sex.
Come on, which is important. Hello.
Which is important.
It is important.
Yes.
I think it's so important what you all are doing. Thank you for shining a light on what this organization does.
And one more thing too is if you are not the trans experience, you can also still help us with referring people to us. If you know anyone, you don't have to be trans or gay to be a referral, but if you know someone who is of the trans experience or non-binary femme who would be interested or eligible for our study, you can refer them to us, and when they call and join our study, and we will compensate you $50 for referrals.
Come on.
So you don't have to be trans to help our study either. Everyone can help us out.
That's right, and understand that there are resources here for all
and get some money before the holidays.
Okay, listen, thank y'all so much for being here. I really appreciate you all's time. And look, speaking of money, we have a special offer for our Great Day viewers. If you're eligible for the study and you let T-Shirt know that you watched this segment, when you successfully enroll, you will get a bonus $50 in Visa gift cards. But you have to enroll before January 31st. More information about the study and all the work that T-Shirt Louisiana is doing, log on to the website on your screen or call 504-894-2738. And stick with us, everybody.